Hi, I'm Dr. Matt B, and these are your emotional minutes. And today we're talking about rumination. And so, what the heck is rumination? Rumination is actually something that's commonly found in everybody. There's times where people will ruminate, but kind of extensive or frequent long-term periods of ruminating is pretty commonly found in things like depression and in a number of the anxiety disorders, things like especially like generalized anxiety disorder, also sometimes things like social anxiety disorder as well. And really, what rumination is just really thinking through or mulling over something. And this can really happen to any of us if we lose a loved one, when we experience something like grief. We might be thinking a lot about the person and maybe things that we would have said to them or could have said to them, or maybe if we lost a job, we were thinking about things that we might have done different. And sometimes those periods can subside after a little while and sort of go away, and we might not ruminate as much. And so, when it can become problematic for people is when people really start to rely on rumination as a way to kind of go through or plan or try to really figure out their day or figure out their life or things that are happening in their lives. But for those individuals, a lot of times what can happen is rumination can really stick around because people in the short term get kind of a sense that, yeah, they're sort of using a strategy to figure out their life, to get answers, to sort of understand things that happen, whether it's things that they're thinking about maybe in the past of how they failed and how they could have done things differently. And that kind of past focused rumination is often found in depression. And then oftentimes things like sort of more future oriented or future focused rumination can occur in things like generalized anxiety disorder. So if, say, for example, they're worrying a lot about something that's going to happen and they're always ruminating and trying to figure it out, they're sort of thinking about it in their own head, trying to understand how they're going to do it. But really, in being focused on the negative aspects, it keeps them in that sort of negative space with their attention. Their attention's always focused on negative things. All the while, their worry or their anxiety about all those things still sticks around. So they never get a chance to sort of try to deal with or cope with or find adaptive or functional strategies to help them deal with the anxiety or the worry itself. Now, if this is something you notice yourself doing often, there's some sort of strategies to help yourself kind of take your mind off that. One strategy is to, try to get up and do something that's meaningful or enjoyable to you. And that can sort of give yourself something different to do other than spending time ruminating, and can also help focus your attention away from those sort of the negative aspects of those things that you're thinking about. And another thing that can actually be helpful to sort of counteract rumination is to really sort of question the beliefs you might have around it. That rumination is actually a functional thing, that it's actually a helpful thing. So, for example, if there's a situation like completing an errand or a social situation that you have to go into where you're really trying to understand it and trying to work through it, one way to sort of challenge the belief about rumination being functional is to really purposefully go into that situation understanding those things less, almost trying to not sort of work through or think about those things ahead of time and see how it goes. And oftentimes people find that they get through the situation fine, and they might not need to spend all that time kind of thinking through, mulling over those situations. And thus, that their belief about rumination being necessary is actually not supported in that situation. People sort of start to see that they might need to rely on rumination a lot less than they thought, and then they get out of that pattern. If you find that you are ruminating or mulling over things a lot, then I always recommend contacting a mental health provider, finding kind of tools and strategies to counteract rumination. And so hopefully that was helpful today. And so again, I'm Dr. Matt B, and these are your emotional minutes, and we will see you next time.